It was a regular work shift, just like any other. The crew arrived early, exchanged a few jokes, and prepared for the day ahead. But something about Michelle was different. Michelle, a lead hand, had always been a reliable member of the team. But since her injury, things had changed. With her hand still healing, she'd been reassigned to office duty, a role far removed from the hands-on work she loved. From the outside, it seemed like Michelle just didn't care anymore. She started coming in late, making frequent mistakes, and started to disregard standard safety protocols. Her supervisor gave her a verbal warning and laid out expectations, but nothing seemed to change. They started to question if Michelle's injury had made her lose her edge.
Many supervisors and coworkers aren't trained to recognize the signs of mental health struggles or substance use, which is why they can often get overlooked. Sometimes these changes in behavior are interpreted as laziness, carelessness, or even a lack of dedication.
But from Michelle's perspective, the story was very different. After her injury, the pain was constant. Her doctor prescribed opioids to help manage it. But over time, she found herself needing more just to feel normal. With nothing to distract her, Michelle's boredom turned into frustration and then into despair. The pills seemed to help, but they also left her groggy and unfocused at work. She knew her performance was slipping, but she just couldn't bring herself to explain why. She knew that she was supposed to disclose the opioids as part of her return to work, but she was ashamed.
Substance use often begins with a way to cope with pain, boredom, or underlying mental health challenges. Without support, it can spiral into dependency, affecting every aspect of a person's life. A substance use disorder is a medical condition, and it should be treated as that, not as someone's weakness.
One day, Michelle's supervisor decided to have a different kind of conversation. Instead of focusing on missed deadlines and sloppy work or writing her up, they asked Michelle if everything was okay. That conversation was the turning point. With support from her manager and the union's assistance program, Michelle entered a rehab program. It wasn't easy, but she committed to getting better. A few months later, Michelle returned to the job site. She was healthier, more focused, and ready to contribute again. The team welcomed her back, and her story inspired others to speak up about their struggles.
It's important to recognize that substance use issues do not diminish a person's worth, and everyone should feel valued and supported equally in all aspects of life. Mental health is part of our overall well-being, and anyone can be susceptible to addiction. It does not make anyone less of a person. Since 2016, 3 out of 4 opioid-related deaths were men, and almost half of those employed worked in the trades at their time of death. This is a staggering and serious statistic. Those with addiction or substance use issues should be treated with dignity and respect and be able to get the help that they deserve.
Michelle's story is a reminder that behind every change in behavior, there is a story waiting to be heard. Substance use disorders are treatable, and recovery is possible, especially when workers and management come together to break the stigma and support one another. Remember, safety is everyone's responsibility.